All right, in this recording, we are going to look at some additional muscles that attach to the scapula, and as they contract, they're going to move the scapula in some manner. All right, so previous video, we talked about the rotator cuff muscles. These do attach to the scapula. These are primarily involved, however, in moving the humerus, so in moving the shoulder joint. These muscles we're going to see are actually also moving our shoulder joint, but they're also moving the scapula itself. Okay, so if you recall, the scapula is this posterior bone that we see here on the right, and we see it here on the left. So from an anterior view, we'll start with our pectoralis minor. So here we can see it on the left, and here we can see it on the right. The pectoralis minor typically originates on the ribs 3, 4, and 5, kind of near the border of where the rib and the cartilage meet. So ribs 3, 4, and 5, and then it comes up and it attaches to that coracoid process of the scapula. So this small kind of C-shaped bony landmark that you can see here at the end of the pectoralis minor, that is where the muscle inserts. And so remember, the insertion point of a muscle, this is the part where it's actually moving the most. And so as this muscle contracts, it's going to pull and it's going to depress the scapula down. So here, if you read here, the action, it's going to depress and kind of rotate in the downward direction the scapula. Okay, so if we rotate around, we can see, if we go to this lateral side, we can see a muscle known as the serratus anterior. So here we see it on the right, and if we rotate over, we can see it here on the left. So the serratus anterior, the term serratus refers to the term serrated, right? So like you have a knife that is serrated, it has these edges at the end border of the knife. So too does this muscle kind of have these edges, or these quote unquote serrations, right? So this muscle is called the serratus anterior. Anytime you see a muscle that has the term anterior, there's probably also a posterior, and there's a serratus posterior. There's actually a serratus posterior superior, and there's a serratus posterior inferior, but we're just worrying about the serratus anterior for now. And this muscle, when it contracts, it protracts the scapula. And the term protraction means to pull forward. So when this muscle contracts, it is going to pull the scapula forward, all right? So this is sometimes referred to as the boxer's muscle. So if you think about the movement that a boxer makes, it is throwing the arm forward. He or she is moving the arm forward. That is moving the scapula forward at the same time. And as that scapula is moving forward, the serratus anterior is attaching to the ribs, usually to the first 8 or 9 ribs. And it's also attached posteriorly to the scapula. So you can see right here, there's the scapula, and here's our serratus anterior, posterior. And so that is where it originates, and then it originates on the ribs, and it then inserts on the scapula, that kind of medial border, and it serves to pull the scapula anteriorly in this protracting movement. Okay, so again, here is our serratus anterior. Okay, all right. If we rotate to the posterior side of the body, we see this large kind of triangular shaped muscle. We see one here on the right, and we see one here on the left. This is known as our trapezius. All right. The trapezius is a very large muscle, and it's a very unique muscle. It produces lots of different movements depending on which fibers of the trapezius are contracting. So you have superior fibers, you have inferior fibers, and you also have kind of medial or middle fibers, all right? So if the superior fibers are contracting, they're going to rotate the scapula upward and kind of can also move the neck as well. If it's flexing on just one side, it can kind of laterally rotate the neck. If the medial fibers are contracting, then it's going to adduct, or kind of move in the scapula. It's going to bring them in closer together. So like if you're squeezing your shoulder blades close together. And then if the inferior fibers contract, they're going to depress the scapula and kind of rotate it in this upward direction. All right, so you can see over here to the right, this description: inferior fibers assist in depression and upward rotation of the scapula. So all of the movements, a lot of the movements we have whenever we're raising our arm, we're moving our arms out to the side, we're moving forward, we're pinching our shoulder blades back. A lot of this movement is accomplished by the trapezius. And you can generally see the trapezius very well in individuals who have been working their shoulders. And you can generally see it from an anterior view, and it will be bulging kind of at this anterior surface. So here you see the trapezius on the right here, all right? So if we dissect through the trapezius, we'll dissect the right and the left, we get to these smaller muscles here called rhomboid muscles. So here we see in the middle, here's a rhomboid major, and here is a rhomboid minor, okay? Major because it's larger, it's bigger in size, the minor because it's smaller, all right? These attach to our vertebrae here. So you can see the spinous processes of some of our cervical and our thoracic vertebrae. And then they also attach to the medial border of our scapula here, right? So here's our scapula on the right, and here's our scapula on the left. So as these muscles contract, they're going to pull on the scapula, and they're going to adduct the scapula. In other words, they're going to pull the scapula inward. They're going to pull it towards each other. So they're adducting the scapula, okay? They can also slightly rotate the scapula as well, kind of in a downward direction. So you can see here, we can downward rotate and elevate the scapula as well. But the main function here with the rhomboid major and with our rhomboid minor is to adduct and stabilize the scapula, okay? If we continue here to this lateral aspect, we see one called the levator scapulae, okay? So the levator scapulae is a muscle that is, hence its name, it is going to elevate the scapula, okay? It can also kind of downwardly rotate the scapula as well. But the main job is to elevate the scapula, hence its name. The term levator means to elevate, and scapula is referring to the scapula. So this muscle attaches to the superior angle of the scapula here. And so where it attaches, it will then pull. It attaches to generally the first 3 or 4 cervical vertebrae. And as it originates on the vertebrae and then it inserts onto the superior angle of the scapula, it's going to raise the scapula up. So we can serve in elevating and raising our scapula towards the sky. All right. Our trapezius is also helping accomplish this as well. Okay. So we have the trapezius, our rhomboid major and minor. We have our levator scapulae, the serratus anterior, as well as our pectoralis minor anteriorly. Okay. So these are all muscles, and there's other muscles, but these are some of the common muscles that are involved in moving our scapula.